Namaskar, good evening. A very warm welcome to our esteemed dignitaries. Please help me welcome our chief guest, Shri Rajiv Gauba, member, Niti Aayog and former Cabinet Secretary, Government of India, for joining us this evening. Welcome, sir. It's indeed our pleasure to have you over here. We also welcome on stage the awards jury co-chair, Dr. Harsh Mahajan, Chair, FICCI Health Services Committee, and founder and chairman, Mahajan Imaging and Labs. Welcome, sir. And Honorary Brigadier Dr. Arvind Lal, Chair, FICCI Swasth Bharat Task Force, Executive Chairman, Dr. Lal Pathlabs Limited, and Managing Trustee, ALVL Foundation. Once again, good evening, ladies and gentlemen, and a hearty welcome to one of the most awaited and coveted awards evening in the healthcare sector, the 17th edition of FICCI's annual Healthcare Excellence Awards. It's indeed a pleasure that all of you have joined over here. We welcome you once again. The awards, instituted in 2009, recognize the individuals and organizations for their commitment and dedication, their exemplary contribution and innovative work and transformations in the healthcare sector. Ernst & Young is the official tabulator and Estron Healthcare is the supporting partner for these awards. Okay, we didn't officially start because an official start is a huge round of applause for the dignitaries on the dais, to the participants also, to the winners also, and obviously all of you invited guests. Foremost, I would request Dr. Harsh Mahajan to kindly welcome our chief guest, Mr. Rajiv Gauba, with a green certificate and a shawl. Rajiv sir, we are delighted to share that the green certificate states that 6 trees will be planted in your name at the Trees for Ecotourism in Somgo, Sikkim. Thank you. Thank you very much, sir. Now, in order to begin this beautiful evening, I request Dr. Harsh Mahajan sir to give the welcome remarks. Welcome, sir.
Thank you very much. Good evening. After wading through the Delhi traffic, it's unusual even for Delhiites, but guests who've come from outside must think that this is how Delhi is. I assure you, this is not the regular way that Delhi traffic is, but thank you all very much for being here. Mr. Rajiv Gauba, member Niti Aayog and former Cabinet Secretary, Government of India. Mr. C.K. Mishra, who was the jury chair, got held up in Bangalore due to a personal reason and is unable to be here. But he's the one who did all the heavy lifting in deciding ultimately the awards that will be presented today. We do miss him. Brigadier Dr. Arvind Lal, Chair, FICCI Swasth Bharat Task Force, and Executive Chairman, Dr. Lal Pathlabs, and Managing Trustee of the ALVL Foundation. Distinguished jury members, awards nominees and participants, FICCI Health Services Committee members, partners, members of the media, ladies and gentlemen. It gives me great pleasure to welcome you all to the 17th edition of the FICCI Healthcare Excellence Awards. We are deeply honored to have with us Mr. Rajiv Gauba, member Niti Aayog, former Cabinet Secretary, Government of India, in fact, the longest serving Cabinet Secretary of the Government of India for 5 years. As our chief guest this evening, sir, it's a privilege to have you with us today. Mr. Gauba is one of India's most respected civil servants, known for his visionary leadership, administrative acumen, and immense contribution to public policy and governance. During his illustrious career, he has steered major national initiatives across diverse sectors. His contribution in ensuring effective implementation of flagship programs and strategic priorities are widely acknowledged. He has held several senior positions in leadership, including, like I said, as Cabinet Secretary, Union Home Secretary, Secretary in the Ministry of Urban Development, and as the Chief Secretary of Jharkhand. I may also add, on a personal note, since this is a healthcare audience, that after his 11th class, 12th class, he joined the All India Institute of Medical Sciences in Delhi for his MBBS. But God had other plans for him. He did not like the few months of medicine that he went through at the All India Institute. And without telling his parents, he resigned and went back to his home state because God had ordained him for much, much bigger things. And in a way, it was a good decision, even though your parents didn't like it at that point of time. So he is an MBBS of a few months amongst us today. Sir, your presence this evening is truly inspiring for all of us in the healthcare community. It reflects the government's sustained commitment to strengthening India's healthcare ecosystem and ensuring quality and accessible care for every citizen. We are truly honored to have you join us as we celebrate excellence and innovation in healthcare. And during our brief discussion before we brought him in, he's been tasked by the Prime Minister specifically to look at governance issues and infrastructure issues across all industries in this country. And he's already, thank you very much for that, told us that governance issues, the thousands of permissions that we in healthcare need to take, he's willing to address them and systematically bring them down to whatever are the barest necessities for proper functioning. Thank you for that, sir. Would have been a pleasure to welcome Mr. C.K. Mishra, who's not here, former Secretary, Ministry of Health and Family Welfare, Ministry of Environment, Forest and Climate Change, and also who has been the chair of the awards jury since the last few years for his continued guidance and support to FICCI. Under his leadership, the jury has carefully evaluated entries to select organizations and individuals whose work exemplifies innovation, impact, and sustainability. FICCI Healthcare Excellence Awards were instituted in 2009 to recognize and felicitate outstanding contributions to healthcare for those who've gone beyond the ordinary to enhance efficiency, affordability, and overall quality of healthcare in India. Over the years, these awards have come to be regarded as the definitive recognition for excellence in the Indian healthcare sector. And may I tell you that E&Y and Astron, actually, this is a 6-month exercise. These are awards which you can't pay and win, unlike many others. These are awards which are given to the truly deserving, and in many cases to those who haven't even applied for the awards or who don't even know that such awards exist. The theme, Inspire, Change, Together, captures the spirit that drives India's healthcare transformation. The journeys of our awardees reflect this spirit of resilience, collaboration, and collective progress. With each passing year, the awards continue to celebrate those who lead by example, who inspire change, bring hope, and contribute meaningfully to building a resilient healthcare system for our beloved nation. I extend my heartfelt congratulations to all participants, finalists, and winners. May your achievements continue to motivate others in the collective mission of advancing healthcare in India. Once again, I warmly welcome you all to this evening of celebration and inspiration and education and learning. Thank you very much.
Thank you very much, Dr. Mahajan, for your warm welcome words. We highly appreciate it. As the Chair for Awards Core Group, I now invite Dr. Y.P. Bhatia, Chairman and Managing Director, Estron Group, to briefly explain about the evaluation criteria and the selection process that makes these awards so distinctive and coveted. Welcome, sir.
Mr. Rajiv Gauba, Brigadier Lal, and Dr. Harsh Mahajan, and a lot of people in the audience who have been so much of instrumental in making these awards happen. Ladies and gentlemen, I have been associated with these awards for probably over a decade, taking some kind of mentorship from Dr. Narottam Puri, who had been guiding our award system earlier. And now also we keep on working with a lot of learning for that. And of course, the FICCI Healthcare Committee, under whose guidance the whole process goes on. As Dr. Harsh very rightly brought out, in today's era of awards, where practically there's an award function every week being held somewhere or the other. These are the awards which have stood the test of time. They have been very clearly said that you have to earn this award by going in for excellence. There have been a refinement of the process over last 16 years, as we have been seeing. And I'll just explain you as the award subcommittee chair that how we go about doing it. The whole process starts almost 9 months before the award function, where we start reviewing the categories and the definitions of the categories which we have been having for the previous year, because every year is a learning. Every year we come across some of the innovations, some of the better definitions, and how the participants, we can have a wider participation from the places, very rightly said, where people don't know about the awards or where we can reach to them about the awards. And there are changes every year. Like this year, it was brought out that we have been doing award for all the categories, but one core area which we have missed, that has been the nursing excellence. So it was thought of, though a little late in the day, but it was thought of that let's put across our mind together, our head together. And I'm happy to share with you that this year, the Chairman's Awards are also being awarded to 3 nursing professionals. I am grateful to some of the senior nursing professionals who helped us in creating the criteria for selection. And here I share with you that for every category, we have the selection criteria. Once we receive the applications, the nominations, we go for scrutiny, which is being done by E&Y. And once the scrutiny is over, the distinct system of an interim jury starts. For every award category, an interim jury team is set up of 5 experts who can contribute and who can evaluate this. And that's an evaluation in confidence but consensus, by which we are able to select about 5 nominees in each category for the award consideration. And that's where our differentiator starts, the on-ground evaluation. So whatever are the nominees who have been shortlisted, a team from Estron is actually getting in touch with them that what has been claimed in the application for the award, does it really exist on ground? And I can share with you that there have been a number of occasions where the claims are far too high than what actually happens on the ground. And sometimes even the project hasn't been initiated for which the award is being sought for. So that's I think, one of the biggest differentiator that we have in any other awards, that the validation which takes place, and then all the shortlisted nominees are required to come for the final jury, a grand jury which is being headed by Mr. C.K. Mishra at the moment, for making a presentation in front of the jury. And the jury membership also changes with every category. Even the grand jury, there are different set of members for each category. And accordingly, based upon their recommendation, what we are going to be presenting to you, the awards, that the actual award thing happen. In addition to that, we have individual awards which are there for the people of excellence, for which, of course, there is no such selection process. But at the same time, either they are self-nominated or nominations by research. And I can tell you, sometimes, you come across with such, strong evaluations. In the healthcare humanitarian this year, Dr. Puri and her should remember, we had such a tough time in the healthcare humanitarian. There were more than 16 such categories, such people who had done such wonderful works, totally unknown. And once we share with you their stories, in fact, what we recommended to Dr. Harsh Mahajan, that each such member should actually be taken up as a case study, and we should be able to hold a webinar or something like that once in a month as FICCI webinar, so that such beautiful works, such great works which have been done by people, which could be presented to the larger group of people, so that this is really exemplary. And of course, having done that, these are the individual awards. And in addition to that, as I told you, that this year we have introduced the individual award, the President's Award for the Nursing Excellence. And I'm happy to share that though we went for a very short notice, but at the same time, we had good about 24 nominees which were required to be considered. And I think one of the toughest, we had to had a separate meeting actually to discuss only on the Nursing Excellence Award out of that. And that's ladies and gentlemen, the process. A lengthy process, a little tough, as we were walking across to this place today, Harsh was mentioning that many times the jury by itself, we used to get some of time, some recommendation or something, and now people have given up. That this committee doesn't consider anything except the excellence. And for that excellence, I congratulate all of you. I congratulate everyone. And of course, the nominees who are there, of course, one will get the award, but all others, it was a very difficult time for the jury to get and select one. And for that, hats off to all of you. Congratulations to all of you. All the best. God bless.
Thank you very much, Dr. Bhatia, for taking us through the entire process of selection and evaluation. We appreciate the jury's fair and wise judgment in evaluating the applications, which has helped the awards emerge as a definitive recognition for best practices in the healthcare industry under the aegis of an eminent jury panel. We are extremely thankful to the jury chair, Sri C.K. Mishra sir, for providing his guidance, experience, and time in evaluating and selecting the winners. Now, we're extremely grateful to have with us Sri Rajiv Gauba on this very significant occasion. Please, ladies and gentlemen, help me welcome him for his very important address for the participants and also for all of us. Welcome, sir.
Dr. Harsh Mahajan, Dr. Arvind Lal, ladies and gentlemen, first of all, my heartiest congratulations to all the awardees. As was explained just now, it's a very rigorous, transparent process, and so all of you deserve a round of applause. And it's really an honor and privilege to be here and to address this distinguished audience. The annual FICCI Healthcare Excellence Awards, it's an event which not only celebrates individual and institutional accomplishments, but it also reflects a collective commitment to advancing healthcare in India. And I think FICCI also deserves compliments for this commendable initiative, which is now in its 17th year. So healthcare is not just another important sector, it is by far the most vital sector that touches every life, every individual, every family. And I'm grateful for having been invited to this opportunity. I never say no to an event like this. You know, you don't want to miss an opportunity to get to know doctors. You want to be in the good books of doctors. God knows when you will need them. Even for national development and for economy, I think healthcare is of utmost importance. With 65% of our population below age 35, we have an immense opportunity, but we will be able to realize the full potential of these demographics only if we have a healthy workforce. And this window of opportunity is not going to last forever, it is closing rapidly. We are in the middle of a demographic transformation which is really tectonic in proportions. We sometimes don't realize it. So we are one of the youngest countries in the world at present, but we are also going to age rapidly, and the percentage of elderly population is projected to double from 10% now to 20% by 2050. So we must parallelly begin to prepare for active and healthy aging in order to unlock the potential of longevity dividends. So essentially, we have to realize that investing in the health of citizens is not a cost, but it is an investment for realizing the vision of Viksit Bharat. In recent years, India has made commendable strides in expanding access to healthcare services, improving health outcomes, and fostering innovation. Ayushman Bharat has been a truly path-breaking initiative. The PM Jan Arogya Yojana and the PM Bharatiya Jan Aushadhi Pariyojana, they have created a financial shield for the underprivileged citizens, averting for crores of individuals and families the financial catastrophe which often follows or accompanies a serious disease or hospitalization. And with over 33,000 hospitals empaneled, I think PMJ is the world's largest health scheme fully financed by government. More than 2,000 generic drugs are now being made available through the 16,000 plus Jan Aushadhi centers at prices which are 50 to 80% less than that of branded equivalents. Health sub-centers have been upgraded as 1.8 lakh Ayushman Arogya Mandirs, which provide comprehensive primary health care services free of charge and which offer screening, prevention, control, and management services. So these initiatives have produced very significant positive outcomes. Between 2015 and 2023, government health expenditure has increased substantially from 29% to 48% of the total health expenditure. And out-of-pocket expenditure has fallen from 62% to less than 40%. Now, this decline has saved households over rupees 1.25 lakh crores, preventing millions from being pushed into poverty due to medical reasons, medical costs. However, significant challenges remain. First, there are issues of access and equity because there are substantial deficiencies in healthcare availability, particularly in rural areas and underserved areas. Second, affordability remains a major concern. It continues to be a barrier for many people, pushing families into penury in cases of serious diseases or medical emergencies. And third, there are gaps, serious gaps in terms of consistent quality and patient safety across healthcare facilities. This vary hugely across different kinds of healthcare facilities, across geographies. And fourth, human resources and capacity. There is need to urgently address shortages of healthcare professionals and enhancing and upgrading their skills, ensuring that they remain updated. Even though we have considerably expanded our health infrastructure, the number of AIMS has increased from 7 to 22, and medical colleges have increased from 387 in 2014 to now 704. And we have added over 1 lakh new medical seats in the past 11 years. There is still a shortage of medical seats, forcing thousands of our children to go abroad for medical education every year. I recall, when the COVID pandemic started unfolding in January 2020, when we had to evacuate the first batch of Indians from abroad. Those were medical students studying in Wuhan in China. And again, when the hostilities between Russia and Ukraine broke out, we had to evacuate children from Ukraine who happened to be mostly medical students. So that is the kind of shortages that we have. And to address these challenges, we need to prioritize some areas of action. One, we have to further strengthen our primary health care, which is the first point of contact and is crucial for prevention, reducing disease burden, and load on tertiary care facilities. Second, implementing national quality standards across the board to ensure that all patients receive safe and effective care. And three, adopting appropriate mix of financing models and options with a combination of schemes like PMJ and paid health insurance for those who can afford them. Fourth, a substantial scaling up of infrastructure, both in public and private sectors. Often, we hear this debate, public or private. I think there is no rivalry, or it's not an either or question. I think both need to coexist and both need to be expanded. Healthcare facilities as well as the medical education capacity for basic degrees as well as for specialization, and for doctors as well as for allied healthcare professionals, and for continuous professional development and capacity building. Now, this will require streamlining regulatory frameworks, which are in many instances they have become outdated, they have become archaic. For example, land and building requirements, norms governing permanent and full-time faculty vis-a-vis contractual hiring, using private hospitals for clinical experience, and so on. I mean, Harsh mentioned this in his opening remarks. We have this committee set up now to usher in second generation reforms in the country across all sectors. So we need to revisit our regulatory frameworks and rationalize them so that we can realize the full potential of our economy, including the health sector. So by combining the strengths of public and private sectors, public policy and private sector efficiency, I think we can deliver solutions which are scalable and sustainable. Such reforms will not only help meet our own medical education requirements, but will also can help position us as a leading center for medical education, serving neighboring countries, serving other developing nations, which will be also a big boost for the economy. India has already established itself as a premier medical care destination thanks to a combination of quality care and affordability, but we can capitalize on it much more, for which we will have to simplify our regulatory requirements. So we will welcome an interaction on these issues and take this agenda forward. We are in fact reviewing all such issues in the high-level committee, which I just now mentioned, which has been constituted recently following the Prime Minister's announcement on 15th August this year to usher in the next generation reforms. Fifth, I think we need to fully leverage technology. Digital health solutions, telemedicine, data analytics, and AI tools now can enhance service delivery and decision making. The Ayushman Bharat Digital Mission, ABDM, has laid the foundation for a future where every citizen can access care seamlessly. And I think about 80 crore accounts have already been created, and this massive adoption demonstrates that people are ready to embrace this digital infrastructure. The lessons of COVID pandemic have underscored, like never before, the critical importance of developing indigenous capacities to secure our health needs, from workforce and supply chains to indigenous research and manufacturing. We face substantial gap in fundamental research and development, and I think our companies need to invest much more in R&D. But today evening, I think it belongs to the awardees. We are honoring those who have exemplified excellence in healthcare. You have all demonstrated leadership. You have exemplified innovation, and above all, a steadfast commitment to improving health outcomes and serving humanity. Nothing can be more noble than that, and I'm sure that your achievements, your selfless service will inspire countless more individuals and institutions and help save lives and help improve the quality of life of our people. So let us on this occasion reaffirm our collective resolve to work together to address challenges, embrace innovative ideas and technologies which can transform healthcare delivery, and let us dedicate ourselves to the pursuit of excellence in all dimensions of healthcare. Thank you.
Thank you very much, sir, for your inspiring words and also for your valuable presence. We are highly grateful for the same. Ladies and gentlemen, we now move to the moment we were waiting for, since probably morning or many months. Yes, I'm talking about the awards. Foremost, we start with the general award categories. This year, 200 entries were received from more than 120 organizations across the country. Huge number. We shall announce the winners for one entire category first and then request them to join one by one on the stage to receive the award from the chief guest. First category, Excellence in Patient Care and Service Delivery, where we have 4 subcategories, beginning with Excellence in Patient Care and Service Delivery, Private Hospitals. Let's have a look at the nominees on the screen.
The occasion of the 17th FICCI Healthcare Excellence Awards, we come together to celebrate and honor the exceptional individuals and organizations that have left an indelible mark on the healthcare landscape. Their unwavering commitment and groundbreaking innovations have not only transformed lives, but have redefined the very essence of healthcare excellence. Nominations in the category of Excellence in Patient Care and Service Delivery, Private Hospitals are Surya Hospitals, Rajagiri Hospital, Kerala, Sri Ramachandra Institute of Higher Education and Research, B.M. Birla Heart Hospital.
I request Chief Guest Sir, Mr. Rajiv, to kindly announce the winner, please.
So the winner is Rajagiri Hospital, Kerala.
For their initiative, Pinnacle Elevating Standards Transforming Care. Congratulations. Next, we have the Excellence in Patient Care. Excellence in Patient Care and Service Delivery, Public Hospitals. Let's have a look at the nominees on the screen first.
Nominations in the category of Excellence in Patient Care and Service Delivery, Public Hospitals are Jawaharlal Institute of Postgraduate Medical Education and Research, UN Mehta Institute of Cardiology and Research Center, Civil Hospital, Ahmedabad.
I request Sir to announce the winner, please.
Jawaharlal Institute of Postgraduate Medical Education and Research.
Congratulations to the winner, Jawaharlal Institute of Postgraduate Medical Education and Research. For the initiative, Back Referral Triage Model for Low-Risk Pregnancies, Improving Care Efficiency and Optimizing Resources at JIP MER. Next category is Excellence in Patient Care and Service Delivery, Other Healthcare Providers. Let's have a look at the nominees.
Nominations in the category of Excellence in Patient Care and Service Delivery, Other Healthcare Providers are Novartis Healthcare Private Limited, Anhad India, Vedanta Medical Research Foundation, Balco Medical Center.
And I request Rajiv Sir to kindly announce the winner, please.
Vedanta Medical Research Foundation, Balco Medical Center.
Congratulations to Vedanta Medical Research Foundation, Balco Medical Center. That's for the initiative Care Beyond Treatment, Holistic Support System for Cancer Patients. Next, we have Excellence in Patient Care and Service Delivery, Startups, Let's have a look at the nominees.
Nominations in the category of Excellence in Patient Care and Service Delivery startups are Pragmatech Healthcare Solutions Private Limited, Cipla Digital Health Limited, Alive Health,
I request Sir to announce the winner, please.
Pragmatech Healthcare Solutions Private Limited.
Congratulations to Pragmatech Healthcare Solutions Private Limited for their initiative screening women from rural and urban poor, Chennai for HPV using the SurveyCheck self-sampling kit, adoption and acceptance. Now, it's time to receive the award. I would request the winners to come on the stage to receive the award. Foremost, Rajagiri Hospital, Kerala for excellence in patient care and service delivery. I request our chief guest to do the honors, please. Can we extend a huge round of applause? The first award, and I promise you have to do till the last one too. Many, many congratulations. I request everyone to kindly step from the left-hand side and disembark from here. Next is Jawaharlal Institute of Postgraduate Medical Education and Research for Excellence in Patient Care and Service Delivery, Public Hospital. Welcome. Next is Vedanta Medical Research Foundation, Balco Medical Center for Excellence in Patient Care and Service Delivery. Other healthcare providers, we welcome you. I said you'll have to do for all the time. Little louder. They work hard. We now welcome Pragmatech Healthcare Solutions Private Limited for excellence in patient care and service delivery startups. Welcome, madam. Congratulations to the winners and good luck for the future. Thank you. You can relax, gentlemen. Thank you. Now we're moving forward with category 2, excellence in patient safety. We have 2 subcategories in this, beginning with excellence in patient safety, private hospitals. Let's have a look at the nominees.
Nominations in the category of Excellence in Patient Safety Private Hospitals are Amrita Institute of Medical Sciences and Research Center, Faridabad, MGM New Bombay Hospital, Vashi, KIMS Healthcare Management Limited.
Requesting sir to announce the winner, please.
Amrita Institute of Medical Sciences, Faridabad.
Congratulations to Amrita Institute of Medical Sciences and Research Center, Faridabad, for the initiative advancing patient safety through integrated stewardship and clinical practice guidelines. Moving next is excellence in patient safety, other healthcare providers, and the nominees are
Nominations in the category of Excellence in Patient Safety, other healthcare providers are City X-Ray and Scan Clinic Private Limited, HLL Life Care Limited, Vedanta Medical Research Foundation, Balco Medical Center, Venus Remedies Limited.
I request Rajiv sir to kindly announce the winner, please.
It's HLL Life Care Limited.
Congratulations to HLL Life Care Limited for their initiative. End-to-end healthcare management for the construction workers in the state of Maharashtra, from health screening to treatment. Congratulations. I would now request the winners to come on the stage to receive the award. Foremost, Amrita Institute of Medical Sciences and Research Center, Faridabad, for excellence in patient safety, private hospitals. Welcome. Congratulations, sir. Thank you. Next is HLL Life Care Limited for excellence in patient safety, other healthcare providers. We welcome you to receive your award. Thank you, gentlemen. We now move to the category 3, Training and Skill Development Initiative of the Year. We have 2 subcategories in this category, beginning with Training and Skill Development Initiative of the Year, hospitals, health tech, other healthcare providers. Let's have a look at the nominations on the screen.
Nominations in the category of Training and Skill Development Initiative of the Year, hospitals, health tech companies, other healthcare providers are Healthcare Sector Skill Council, Medicom Ventures Private Limited, Max Smart Super Speciality Hospital.
Requesting Rajiv sir to announce the winner, please.
Medicom Ventures Private Limited.
Congratulations to Medicom Ventures Private Limited for their initiative, setting up a state-of-the-art nursing training lab at Dimapur's Christian Institute of Health Sciences and Research. The lab ensures sustained high-quality training for future healthcare professionals. Next, we move to Training and Skill Development Initiative of the Year, Medical Institutes and Colleges. The nominees are
Nominations in the category of Training and Skill Development Initiative of the Year, Medical Colleges, Institutes are King George's Medical University, Bhai Kaka University, Sri Ramachandra Institute of Higher Education and Research.
I request sir to announce the winner, please.
King George's Medical University, UP Lucknow.
Many, many congratulations. For the initiative, Patient-Centering Nursing Excellence Program for Hospitals. Now, ladies and gentlemen, also, the jury felt that a certificate of appreciation should be granted in this category to Bhai Kaka University for the initiative Building a Continuum of Safety, a multi-level initiative for embedding patient safety and quality through longitudinal undergraduate, interprofessional and postgraduate curricula. And also to Sri Ramachandra Institute of Higher Education and Research for their initiative, Virtual Reality. If you're here, you can clap for yourselves, guys. Congratulations. I would now request the winners to come on the stage to receive the award. Medicom Ventures Private Limited for the category Training and Skill Development Initiative of the Year for hospitals, health tech, other healthcare providers. Congratulations. Thank you. Next is King George's Medical University for the category Training and Skill Development Initiative of the Year, Medical Institutes and Colleges. We welcome you. I would now like to call upon Bhai Kaka University team for the Certificate of Appreciation. We welcome you, sir. And we now welcome Certificate of Appreciation granted to Sri Ramachandra Institute of Higher Education and Research. Congratulations. Thank you. Thank you, gentlemen. Moving next, we have the Category 4, Excellence in Community Engagement. Here, we have two subcategories, beginning with Excellence in Community Engagement, NGOs, not-for-profit organizations. Let's have a look at the nominees.
Nominations in the category of Excellence in Community Engagement, NGOs and not-for-profit organizations are Integral Hospital, IIMSR, Integral University, Lucknow, Sankara Eye Foundation, India, LV Prasad Eye Institute, WHO Collaborating Center for Emergency and Trauma Care.
I request sir to announce the winner, please.
LB Prasad Eye Institute.
Congratulations to LV Prasad Eye Institute for the initiative Sight for All, Sight Saved, Futures Transformed, the ROP journey across Odisha. Also, the jury felt that a certificate of appreciation should be granted in this category to Integral Hospital, IIMSR, Integral University, Lucknow. Congratulations. Moving next, Excellence in Community Engagement for Profit Organization. And the nominees are
Nominations in the category of Excellence in Community Engagement for Profit Organizations, Hospitals, MedTech, Device Companies, other healthcare providers are Wells Medical College and Hospital, ITC Limited, Roche Diagnostics India Private Limited,
I request sir to kindly announce the winner, please.
It's ITC Limited.
Congratulations to ITC Limited for the initiative Swasth Kiran Sachal Netra Seva, taking high quality, affordable eye care to rural hinterlands. I would now request the winners to kindly come on the stage to receive the award. LV Prasad Eye Institute. Congratulations and we welcome you. Thank you. Good wishes. We now call upon stage ITC Limited for excellence in community engagement for profit organizations. Congratulations, sir. And now, Certificate of Appreciation granted to Integral Community Awareness Network, ICANN. We welcome the team. Congratulations. Thank you very much. Thank you, gentlemen. Next, we are moving to Category 5. Technology Transformation Initiative of the Year. We have 3 subcategories, beginning with Technology Transformation Initiative of the Year, Hospitals, Other Healthcare Providers. Let's have a look at the nominations.
Nominations in the category of Technology Transformation Initiative of the Year, Hospitals, Other Healthcare Providers are Astor Whitefield Hospital, CK Birla Hospital, Jaipur, CK Birla Hospital, CMRI, Kolkata, Manipal Hospital, Old Airport Road, Bangalore.
I request, sir, to announce the winner, please.
Astor Whitefield Hospital.
Congratulations to Astor Whitefield Hospital. It's for their initiative Walk-in FAPI PET-CT imaging service at Astor Whitefield Hospital. Next is Technology Transformation Initiative of the Year, MedTech and Device Companies, Software Developers. Let's have a look at the nominees.
Nominations in the category of Technology Transformation Initiative of the Year, MedTech and Device Companies, Software Developers including mobile applications are SS Innovations, Gen Robotics Medical and Mobility, Stan Plus Technologies Private Limited, AMTZ.
May I request the Chief Guest, sir, to announce the winner, please.
SS Innovations.
Congratulations to SS Innovation. It's for the initiative SSI Mantra, Teleproctoring and Telesurgery. Also, the jury felt that a certificate of appreciation should be granted in this category to Gen Robotics, Medical and Mobility. Congratulations. Moving next, Technology Transformation Initiative of the Year, Startups. And the nominees are
Nominations in the category of Technology Transformation Initiative of the Year, Startups are Oxidius Health, World Health Innovation Forum, Medisim VR.
I request Sir to announce the winner, please.
Medisim VR.
Congratulations. It's for their initiative Medisim VR Lab. Also, the jury felt that a certificate of appreciation should be granted in this category to World Health Innovation Forum. Congratulations. And we would now request the winners to come on the stage to receive their award. Astor Whitefield Hospital for Technology Transformation Initiative of the Year. Hospitals, other healthcare providers. Congratulations, gentlemen. Oh, the team is here. You can applaud for yourselves, guys. You are the maximum strength over here. Congratulations. We now welcome on stage SS Innovations for Technology Transformation Initiative of the Year. Welcome, sir. MedTech and device companies, software developers. Congratulations. Congratulations. We now call upon stage Medisim VR for Technology Transformation Initiative of the Year, Startups. Okay. They're not here, I suppose. Okay. Congratulations and welcome. Certificate of Appreciation granted to Gen Robotics, Medical and Mobility for Technology Transformation Initiative of the Year. Hospitals and other healthcare providers. We welcome. Congratulations and good wishes. Certificate of Appreciation granted to World Health Innovation Forum for Technology Transformation Initiative of the Year, Startups. Congratulations, sir. Thank you, gentlemen. Ladies and gentlemen, we now come to the individual awards, which are not applied for, but are nominated by FICCI health committees and the awards jury members. The first award in this category is the Nursing Excellence Award. FICCI Nursing Excellence Award has been introduced this year as individual recognition to the nurses who have demonstrated exceptional dedication, leadership, and impact in the field of nursing and healthcare. This award seeks to honor nursing professionals whose life and work exemplify the highest standards of care, leadership, innovation, and compassion, setting a benchmark for others to follow. It celebrates those who go beyond clinical excellence, demonstrating remarkable initiative, empathy, and vision in strengthening patient care and institutional effectiveness, and inspiring excellence within the nursing fraternity. Foremost, I request Chief Guest to announce the awardees, please.
Captain Dr. Usha Banerjee,
Congratulations, ma'am.
Miss Thankam Gomez, and Miss Beenama Purayan.
I now request Captain Dr. Usha Banerjee to join us on the stage to receive the award, please.
Nursing Excellence Award. Captain Dr. Usha Banerjee, Group Director Nursing, Apollo Hospitals Group. Captain Dr. Usha Banerjee is one of India's most accomplished nursing leaders, whose remarkable career has redefined the role of nursing in healthcare delivery, professional empowerment, and institutional governance. From graduating with top honors at the Armed Forces Medical College, where she received the President's Award, to her current role as Group Director of Nursing at Apollo Hospitals Group, Asia's largest integrated healthcare network, she has consistently embodied vision, resilience, and transformative leadership. Her pioneering frameworks in specialty nursing, in-service education, nurse-led clinics, and leadership pathways have repositioned nurses as not just caregivers, but vital partners in clinical governance and institutional strategy. Through her work with Manipal, Max, and now Apollo
Gentlemen, you can
Hospitals,
take your seats.
she has built global benchmarks for nursing practice while creating pathways for workforce development and succession planning. Beyond the hospital setting, Captain Banerjee has championed humanitarian initiatives for underprivileged women and children, led disaster and pandemic responses, and guided policy reform through national and international platforms. With over 60 publications and mentorship of more than 100 nurses, she has strengthened the academic and evidence-based foundation of the profession. She is recipient of many awards, including Countess of Dufferin Award and Field Marshal Cariappa Award. FICCI proudly confers the Nursing Excellence Award on Captain Dr. Usha Banerjee, honoring her visionary leadership, pioneering contributions, and lifelong dedication to advancing nursing and healthcare in India.
I request Captain Banerjee to say a few words on this occasion. Welcome, ma'am.
Dignitaries on the dais, off the dais, ladies and gentlemen, good evening. I'm extremely grateful to FICCI and the eminent jury for acknowledging my work and giving me this honor. This accolade transcends me as an individual. It's an ode to where I belong, the nursing profession, its relentless spirit and indomitable presence as a sinew and soul of healthcare. I thank FICCI for being the vanguard that has crafted, created, contoured, steered, propelled, and stood at the forefront to be an advocate and a voice of amplification for the nursing profession and positioning them rightfully in the healthcare, not just as mere caregivers, but as architects of change and leaders of transformation, and aligning them to the larger healthcare agenda of the nation. I take this moment to pay my tribute to my alma mater, my teachers at the Armed Forces Medical College, to all my people who have mentored and taught me in the legendary organizations that I have worked, the Manipal Hospitals, Max Healthcare, Dr. Narottam Puri, my boss, is seated here. And of course, now at the Apollo Group, where I have worked for 20 years, which has given me the wisdom to lead, the advice to follow, the humility to celebrate my success, and the inspiration to aspire for more. I accept this honor with solemn pride, with profound humility, and a sacred responsibility to do better for the nursing profession, for the teams that I lead, for the enterprises that I work, and for the healthcare of the nation at large. Thank you.
Thank you very much, sir, for sharing.
Play the thing and then invite them.
Thank you very much, madam, for sharing your emotions with us. I now request Ms. Thamkum Gomes to join us on the stage after the video is being played. Video, please.
Nursing Excellence Award, Ms. Thankam Gomez, Founder CEO, Signia Healthcare. Ms. Thankam Gomez is a distinguished nursing leader and entrepreneur whose 4-decade career has transformed patient safety, nurse empowerment, and leadership development across India. As founder and CEO of Signia Healthcare, she has pioneered leadership programs, simulation-based experiential learning, and evidence-informed consulting that have strengthened care quality and clinical governance. She is the founder and past president of the Association of Nurse Executives India, a founder member of the Infusion Nurses Society India, and has been recognized nationally as a patient safety ambassador. Her trailblazing capacity building efforts have trained and mentored thousands of nurses across the country, equipping them with advanced skills in patient safety, evidence-based practice, and leadership. Her contributions have earned wide acclaim, including 50 Outstanding Women in Healthcare, the Zee National Healthcare Leadership Award, 21 in 21 Luminary Star, and the FE Visionary Leader Award. FICCI proudly confers the Nursing Excellence Award on Ms. Thankam Gomez, celebrating her visionary leadership, transformative impact, and lifelong dedication to advancing safe and empowered healthcare in India.
We welcome you, madam, on the stage to receive your prestigious award. Ms. Thankam Gomez. Ma'am, we request you to kindly share your valuable remarks with us. The cordless mic? Yeah. Can we have the cordless mic, please? Can we have the cordless, please?
If I stand behind the podium, maybe you will not see me, so I rather stand here. Every moment is precious. And this moment is too precious for me and for the entire nursing fraternity. As Dr. Y.P. Bhatia said, Der aaye, durust aaye. Thank you so much, FICCI, for this special occasion of celebrating nurses. And I stand here acknowledging the recognition given to nurses in India through us. Thank you very much. Good evening, dignitaries on the stage and off the stage, and esteemed jury members. I accept this award with great pride and humility on behalf of all the nurses in India. Because if I have achieved anything in healthcare, it was not my individual feat. I could not achieve all that unless the team was with me, the healthcare industry partners, the leaders, the teachers, colleagues in nursing, and colleagues from all the other departments. Maybe I initiated, they chipped in. So thank you so much to everyone who have traveled this path with me till here today. Though I received many awards, I didn't get this moment of giving a speech. So I'm really, really thankful to the FICCI leadership and the jury for giving me this 1 minute. Thank you so much for that. I would definitely love to thank God Almighty for guiding me in this journey for the last 44 years. I want to thank my father who put me on the path of leadership, and he taught me to speak up. My mother and my family for standing with me throughout. And of course, my son, he never comes with me anywhere, but today he's here. I don't know, he disappeared, for being my constant inspiration and energy source from 1998. I cannot finish my speech unless I thank my golden retriever Riley. For the last 2 years, he has made me younger. So Dr. Dr. Lal was telling, and Dr. Mahajan was also mentioning 44 years. But I would say, kahani abhi baki hai. So I would also love to thank one person who supported me as a single mom to bring up my son, plus do everything that I could do in healthcare. That is Saroj, who is the help at home. She has been with me for 24 years. So there are many more people who have supported. So this award is not mine alone. It belongs to so many people. I stand here with great humility and accept this award. But before I say thank you once again, I would definitely love to request Sir Goba. In the beginning, someone mentioned that you're going to lead the governance and the excellence in healthcare, in all industries, including healthcare. So my humble request is that the Nursing Midwifery Act bill has been passed but is not yet enacted. I would definitely request on behalf of all the nurses in the country that this is just a small step of recognizing 2-3 of us, but nurses, they are the maximum number in the healthcare industry. We would really request you to please enact that. We all are there to support. And as the founder president of Association of Nurse Executives India, we are there to support whichever way we can. Give us a chance and see how healthcare is going to shine. Give us that opportunity. Thank you so much. Thank you for the time given to me. Thank you very much. And once again, I received the award on behalf of all the nurses in the country. Thank you.
Thank you very much, ma'am, for sharing all your warm emotions with us. Ms. Beenama Korean.
Nursing Excellence Award. Miss Beenama Korean, General Manager, Quality, St. John's National Academy of Health Sciences, Bangalore. Miss Beenama Korean is a distinguished nursing leader and quality management expert whose exemplary career has advanced patient safety, clinical governance, and hospital accreditation standards in India. As General Manager Quality at St. John's National Academy of Health Sciences, she ensures adherence to quality and accreditation standards across all units of the institution, working closely with the Chief of Nursing Services to uphold excellence in patients' care. Under her leadership, the hospital has implemented robust frameworks for clinical audits, root cause analysis, CAPA, and internal audits, significantly strengthening its culture of safety and accountability. With over 25 years of leadership in ICU nursing, Ms. Korean has not only delivered critical care with compassion, but also built and mentored multidisciplinary teams to improve patient outcomes. She has directed hospital-wide quality management systems aligned with NABH 6th edition standards, achieving and sustaining accreditation across multiple departments. As Principal Assessor and Technical Committee member of NABH since 2010, a certified internal assessor for JCI and faculty for NABH programs, she has contributed to shaping healthcare quality standards nationally and internationally. FICCI proudly confers the Nursing Excellence Award on Ms. Beenama Korean, honoring her visionary leadership, transformative contributions, and unwavering dedication to patient-centered and safe healthcare delivery across India.
Congratulations to her. Ms. Korean could not join us today due to the official travel overseas. So I request Ms. Ajita Nair, Chief Nursing Officer, KIMS Health, to kindly receive the award, please, on her behalf. Yes, you were extending your warm wishes through round of applause and I stopped in between, but you can do it now. We can have the message from Madam.
With a deep gratitude, I stand before you to accept the honor of FICCI Nursing Excellence Award 2025. I wish
Thank
to
you.
extend my heartfelt thanks to FICCI for this award, which celebrates the spirit of nursing and acknowledge the silent yet powerful contribution nurses make every single day. This achievement would not have been possible without the constant support of my colleagues, my mentors, and I am especially grateful to my husband and my family children for their constant support. As I accept this honor, I am reminded of the responsibility it carries. It is a call to continue striving for excellence to nurture the next generation of nurses. Thank you once again, FICCI, for this recognition. I dedicate this award to St. John's Medical College Hospital, my colleagues both from nursing and quality. Thank you very much.
Thank you. Ladies and gentlemen, moving next is Chairman's Award for
I would like to speak.
Oh, I'm sorry.
Good evening, ladies and gentlemen. Thank you, Dr. Sanjeev, for asking me to receive Beenama's award. She's a very close friend of mine. And I'm extremely happy today to be among two great nursing leaders whom I work with very closely, Ms. Tangam Gomez and Captain Usha. And Beenama also, though not here. And I'm very happy because FICCI has thought of recognizing nursing leadership, and all the while nurses had been along with all the doctors and other professionals, but seldom recognized. And I'm very happy that this FICCI HEAL has recognized nurses, and on behalf of nurses and as the current president of Association of Nurse Executives India, I thank the FICCI officials for taking this step in the positive side. Thank you so much.
Thank you very much, madam. As I was saying, ladies and gentlemen, it's time to recognize individuals who have made exceptional and transformative contributions to the healthcare sector. The award is not focused on clinical excellence, but rather on the individual's administrative acumen and skills. This award celebrates the often overlooked champions in the healthcare realm, the dedicated medical professionals who serve as the driving force behind the success of many healthcare institutions. Let's first have a look at previous year's awardees in this category. Can we applaud for them? Sorry, I need to remind you again and again. Thank you. I now request the chief guest to announce the awardees, please.
Professor Dr. Suresh Hariram Advani and Dr. Anita Borges Posthumus.
Congratulations. You can take your seat, gentlemen. Professor Dr. Suresh Hariram Advani. Can we have the video, please?
Chairman's Award for Outstanding Leadership in Healthcare. Professor Dr. Suresh Hariram Advani, Consultant Oncologist. Professor Dr. Suresh Hariram Advani is a true legend of Indian healthcare, a pioneer who has transformed the way we understand and treat cancer. His journey began at Tata Memorial Hospital in 1974, where he went on to achieve a historic milestone, performing India's first successful bone marrow transplant, giving a young child with leukemia a new lease of life. His landmark clinical trials in childhood leukemia went on to change the future for thousands of children, raising survival rates from just 20% to an extraordinary 70%. Beyond his path-breaking clinical work, Professor Dr. Advani has been a builder of institutions and a mentor to generations. At Jaslok Hospital, where he continues to serve as Chief Medical and Pediatric Oncologist, and across leading hospitals in Mumbai, his healing touch has reached patients from every walk of life. With over 600 research publications, leadership roles in national oncology societies, and numerous awards. From the Padma Shri and Padma Bhushan to the prestigious Dr. B.C. Roy Award, his contributions are celebrated across India and the world. A healer, a teacher, and an inspiration, he embodies excellence and compassion. FICCI proudly confers the Chairman's Award for Outstanding Leadership in Healthcare on Professor Dr. Suresh Hariram Advani, honoring his pioneering contributions, institution building, and lifelong commitment to transforming oncology in India.
Dr. Advani could not join us today due to the health reasons, but we have his son, Mr. Mohit Advani, with us. I request him to kindly collect the award on his father's behalf. And sir has also shared a video message with us. Can we have that, please?
Thank you. Today I feel honored but humbled on receiving the Chairman's Award, an award for Outstanding Leadership in the Healthcare Excellence 2025 from a very prestigious organization, the Federation of Commerce and the Indian Chambers of Commerce and Industry. This recognition is not only for me, but it belongs to everyone, right from my vendors to my colleagues and to my family members who withstood with me and helped me to carry on with the work during a long time in association. Also, it is not the finish line. Award is not the finish line. It fuels my mind to continue creating a work, striving hard and creating the further well-being of the surroundings in healthcare as well as in the country. Again, I would like to thank the organization and the jury members who have selected me for this award. Thank you very much.
Thank you. And second is Dr. Anita Borges. We would like to inform that the Chairman's Award for Outstanding Leadership in Healthcare is being presented posthumously to Dr. Anita Borges. Dr. Borges, who passed away recently, was an eminent surgical pathologist and cancer diagnostician, whose vision, dedication, and compassion greatly advanced the field of pathology and healthcare in India. Throughout her distinguished career, she exemplified excellence, not only through her professional accomplishments, but also through her commitment to mentoring others and improving patient care. Her legacy continues to inspire the healthcare fraternity. We honor and remember Dr. Borges today for her remarkable contributions and enduring impact on healthcare. One of her students is over here, Dr. Colonel Anurag Mehta. He will collect the award on behalf of Dr. Borges. Welcome. Can we have the video also?
Chairman's Award for Outstanding Leadership in Healthcare, Dr. Anita Borges, posthumous. An eminent surgical pathologist and cancer diagnostician, Dr. Borges transformed the landscape of pathology in India through her pioneering diagnostic practices, academic leadership, and commitment to quality standards. Across more than 4 decades, she combined clinical brilliance, academic rigor, and institutional leadership, leaving an extraordinary legacy that continues to inspire. As head of surgery pathology at S.L. Raheja Hospital and director of the Center for Oncopathology in Mumbai, Dr. Borges pioneered advanced diagnostic practices that strengthened the very foundation of cancer care. Her unmatched expertise in head and neck pathology, lymph node metastasis, and complex histopathology guided clinicians to deliver timely, accurate, and life-changing treatments. Her impact extended far beyond patient care. As chair of NABL's accreditation committee, she championed uncompromising quality and accountability in diagnostics nationwide. As Dean of the Indian College of Pathologists, she mentored and empowered generations of young pathologists, shaping the future of Indian medical science with her vision and integrity. A recipient of the President of India Silver Medal and the Lady Ray Silver Medal, Dr. Borges was celebrated throughout her career for her brilliance and leadership. FICCI proudly confers the Chairman's Award for Outstanding Leadership in Healthcare posthumously on Dr. Anita Borges, honoring her enduring legacy of excellence, compassion, visionary leadership, and her towering contributions to cancer diagnostics and the advancement of clinical excellence in India.
We call upon Dr. Anurag Mehta to share his remarks on this occasion, please.
Ladies and gentlemen, I really feel honored accepting this award on behalf of late Dr. Anita Borges. Dr. Anita Borges was my mentor. She was a towering personality, very eloquent, great communicator, and also she was one of the most distinguished pathologists in the context of Indian pathology fraternity. She was one of the finest pathologists in the India and possibly globally. She was very erudite, always updating herself. She was very analytical and very thoughtful. And it was a treat to sit with her while she is reporting. And she always pursued excellence, always updating, always challenging each other. And I learned a lot from her. But she was not only interested in personal excellence, she also wanted to mentor. She was a teacher's teacher, and she had this missionary's zeal to travel and teach others. And with this mission, she was going far and wide, going to less well-connected areas. And on one of these trips, which was thousands of miles away from her home, she breathed her last. Doing what she loved to do. She was full of wisdom, full of knowledge, and wanted to share it. And she exemplified knowledge, wisdom, selflessness, compassion. And FICCI, I thank you for conferring this award on her. She richly deserved it. And this award will celebrate her life, will celebrate her work, celebrate her selflessness, and celebrate her enduring contributions. Thank you so much.
Thank you, sir. To recognize a social activist who has made an outstanding contribution to the healthcare segment in India, a measurable impact in making quality healthcare available in the country without any profit or business motive. Let's have a look at the previous year's awardees in this category. Can we congratulate them? Thank you. I now request the Chief Guest, sir, to announce the Healthcare Humanitarian Award for year 2025.
Shrimati Subhasini Mistry.
Congratulations. Shrimati Subhashini Mistry could not join us today as she is bedridden. We extend our best wishes for her recovery and well-being, and FICCI takes the initiative to send the award at her home.
Healthcare Humanitarian, Srimati Subhasini Mistry, Founder, Humanity Hospital. Srimati Subhasini Mistry is an extraordinary humanitarian whose life story embodies resilience, compassion, and an unshakable commitment to the poor. Born in 1943 in rural West Bengal, she was married at the age of 12. At just 23, tragedy struck. She lost her husband because they could not afford medical care, leaving her a widow with 4 young children. From that moment, she resolved that no one else should suffer the same fate simply because they were poor. For over 2 decades, Srimati Mistry worked as a domestic help, a manual laborer, and a vegetable seller. Despite her meager earnings, She saved every rupee with a single dream: to build a hospital for those in need. In 1992, she bought a small plot of land near Kolkata, and in 1996, her dream became reality with the birth of Humanity Hospital. What began as one-room clinic has grown into a 45-bed hospital serving thousands of underprivileged patients with dignity and care. Her work since has reached even the Sundarbans, one of the most underserved regions of West Bengal. Honored with the Padma Shri and multiple national awards including Godfrey Phillips National Bravery Award and Women Transforming India Award, Srimati Subhasini Mistry stands as a beacon of courage and compassion. FICCI proudly presents Srimati Subhasini Mistry with the Healthcare Humanitarian Award, honoring her unwavering spirit and her selfless mission to provide dignity and healthcare to the most vulnerable sections of the society.
We congratulate her once again and pray for her smooth recovery. Thank you. And can we have the Healthcare Personality of the Year awardees in this category last year? The nominations, the awardees in this category. Okay. Congratulations to all of them. And I now request Chief Guest to announce the Healthcare Personality of the Year 2025.
Professor Dr. Sonia Nityanand and Professor Dr. Shakti Kumar Gupta.
Congratulations. Can we have the video for Professor Dr. Sonia Nityanand?
Healthcare Personality of the Year Award. Professor Dr. Sonia Nityanand, Vice Chancellor, King George's Medical University. Professor Dr. Sonia Nityanand, Vice Chancellor of King George's Medical University, Lucknow, is a trailblazing medical scientist, hematologist, and visionary leader who has dedicated more than 3 decades to advancing healthcare, research, and medical education in India. At KGMU, she has driven sweeping reforms and unprecedented growth under her leadership. The university has established a state-of-the-art bone marrow transplant unit, advanced robotic surgery, a robotic cadaveric wet lab, a 500-bed trauma center, high-end critical care facilities, and Northern India's first analytical toxicology lab. She has also expanded patient welfare services, telemedicine, and training programs that are strengthening healthcare delivery across Uttar Pradesh. Her transformative leadership extends beyond KGMU. As director of Dr. Ram Manohar Lohia Institute of Medical Sciences, she led institutional expansion, launched advanced transplant programs, secured NABH accreditation, and conceptualized India's first modular steel hospital building. Earlier at SGPG IMS, she founded the Department of Hematology, established one of the India's earliest bone marrow transplant programs, and spearheaded pioneering stem cell research. Honored with Padma Shri and multiple national awards, including DBT National Biosciences Career Award, Rajiv Goel Young Scientist Award, and Stree Shakti Award for Best Woman Scientist, Dr. Nityanand continues to inspire as a scientist, reformer, and a leader. FICCI proudly presents Professor Dr. Sonia Nityanand with the Healthcare Personality of the Year Award, honoring her exemplary leadership, pioneering research, and extraordinary impact on shaping the future of healthcare in India.
Congratulations, madam, and we welcome you to receive your award, please. Thank you, and I would request ma'am to say a few words on this occasion.
Shri Rajiv Gauba ji, Dr. Arvind Lal, Dr. Harsh Mahajan, Dr. Y.P. Bhatia, all dignitaries in the audience, all awardees, ladies and gentlemen, a very good evening. And I'm honored to receive the FICCI Healthcare Personality Award for 2025 and accept it with great joy and humility. I must say that I have a special association with FICCI, and with great pride would like to state that for the last 3 years, the King George's Medical University, which I head, has received a FICCI Healthcare Excellence Award. So this was the 3rd consecutive year. And I really appreciate the role of FICCI in promoting excellence and innovation across diverse areas of healthcare. As was highlighted in my citation, that I began by starting a blood cancer unit and a bone marrow transplant program in the state of Uttar Pradesh way back in 1990s. And then I also became a clinician scientist and went into the depth of stem cell research. Currently, I'm also a medical administrator doing institutional building and engaged in healthcare policy making. And I would like to share with great happiness that the King George's Medical University has recently been awarded an A2+ by NAC and rated as one of the top 10 medical universities by the NIRF. So it has emerged as a leading university in medical education, patient care, research, and in community outreach programs. In fact, the Regional Resource Training Program of the university, in collaboration with the UP Technical Support Unit in the field of emergency obstetric care and neonatal mortality, has played a significant role in bringing down the maternal mortality of the state of Uttar Pradesh. And now the world is actually looking at this program as a model program for other countries. I would like to acknowledge my family, especially my father, late Dr. Nitya Anand, whose work leading to the development of the world's first and only non-steroidal, non-hormonal oral contraceptive Sencroman, marketed as Saheli and introduced as Chhaya in the National Family Planning Program of the country, was a great inspiration for me to pursue medicine and science. I also would like to acknowledge my mother, who herself was a clinician, but she taught me self-empowerment as a woman. Of course, my husband has stood behind me as a pillar of strength. So in the end, I want to thank all the jury members for selecting me for this coveted recognition. And in line with the theme of the 7th edition of the FICCI Healthcare Excellence Awards 2025, which is Inspire, Change Together. I think Dr. Harsh Mahajan had brought out in the beginning. This is the theme of this year. I must say that I'm inspired by this award. The first was Inspire. So I'm inspired by this award to contribute more towards changing the healthcare status of the country together with other leaders in this field. Thank you. Jai Hind.
Thank you, madam, for sharing all the emotions with us. We have Professor Shakti Gupta's video because due to the last minute exigency, he could not join us. Can we have the video, please?
Healthcare Personality of the Year Award. Professor Dr. Shakti Kumar Gupta, Executive Director and CEO of AIIMS Jammu. Professor Dr. Shakti Kumar Gupta is a distinguished medical administrator and visionary leader whose transformative work has created a new model of excellence in healthcare delivery and institution building. As the founding head of AIIMS Jammu, he pioneered initiatives such as the pain-free approach, the patient-first philosophy, and the Apna AIIMS Jammu movement, instilling pride and ownership among staff and the community. Despite the unprecedented challenges of the pandemic, He led the completion of 43 world-class buildings in record time. And within its very first year, AIIMS Jammu delivered over 2 lakh outpatient consultations, more than 1,000 trauma and emergency cases, and over 1,100 successful surgeries, all with outstanding patient satisfaction. A former head of hospital administration at AIIMS New Delhi, Professor Gupta has mentored over 45 postgraduate and PhD scholars, guided more than 100 research studies, authored 11 books, and led national and international projects with WHO on hospital governance, digital health, and PPPs. He has also chaired the National Ambulance Code Committee and driven national initiatives on patient safety and emergency care. FICCI proudly confers the Healthcare Personality of the Year award on Professor Dr. Shakti Kumar Gupta, celebrating his visionary leadership, institution building, and transformative contributions to strengthening healthcare in India.
I request Dr. Sanjeev Singh, Medical Director, AIMSRC Faridabad and Chief Medical Superintendent, AIMSRC Kochi, to kindly receive the award on behalf of Dr. Gupta. Thank you, gentlemen. To honor an individual who has left an indelible imprint on the Indian healthcare industry throughout their illustrious career, this distinguished individual, widely acknowledged and revered within the healthcare sector, serves as a beacon of inspiration for present and upcoming healthcare professionals, symbolizing the highest standards of achievement and leadership in the field. Let's have a look at the previous year's awardees in this category. We congratulate all of them. And now, I request Rajiv sir to announce the awardee of 2025, please. Many, many congratulations, sir. Can we have his video, please?
Lifetime Achievement in Healthcare Industry Award. Professor Dr. Shiv Kumar Sareen, Director, ILBS and President, National Academy of Medical Sciences. Professor Dr. Shiv Kumar Sareen stands as one of the most distinguished leaders in Indian medicine, a pioneering liver specialist, institution builder, researcher and reformer whose vision has transformed hepatology, medical education and healthcare delivery. As the founder and director of the Institute of Liver and Biliary Sciences in New Delhi, he created Asia's first dedicated liver institute, seamlessly integrating patient care, teaching and research. Under his leadership, ILBS has emerged as a global center of excellence and a model for healthcare institutions across India. Dr. Sareen's scientific contributions have redefined the practice of hepatology worldwide, from introducing Sareen's classification of gastric varices and pioneering band ligation for variceal bleeding, to defining acute on chronic liver failure and advancing stem cell therapies. His work has set new standards in liver care. Beyond clinical innovation, he has shaped national medical governance and public health. As chairman of the Medical Council of India's Board of Governors, he laid the foundation of reforms like NEET and NEXT. He championed hepatitis B vaccination, launched the Yellow Ribbon campaign, and steered India's national viral hepatitis control program, benefiting millions. Honored with the Padma Bhushan, the Shanti Swarup Bhatnagar Award, and global accolades such as Henry L. Bocuse Medal, Dr. Sareen's legacy is one of science, service, and vision. FICCI proudly confers the Lifetime Achievement in Healthcare Industry Award on Professor Dr. Shiv Kumar Sareen, honoring his visionary leadership, groundbreaking scientific contributions, and enduring service to humanity.
We welcome Dr. Professor Shiv Kumar Sareen to receive the award. And ladies and gentlemen, this is a lifetime award. Kindly rise from your seats and applaud for his superb work in the entire sector. Thank you very much, sir, and indeed a pleasure. We now request you to kindly say a few words to inspire the participants over here. Over to you.
I thank the Almighty God, my revered teachers and my late parents and my family for having seen this day. And thank you, FICCI. Thank you, jury. And thank you, sir. And all of you for giving me this love and affection. I would especially like to mention the role of my father. And I want to share this small incidents with you. So this was my final MBBS medicine first paper. And normally my father would mention that you have to do an exercise for an hour, whatever it happens, before you go to the college. And college at Jaipur was 6 kilometers away. And that day I couldn't finish my revision. So I was just trying to go and then go for a shower. My father looked at me and said, "Well, you haven't done your exercise." I said, "Today is my final paper." He says, "Paper to agle saal bhi ho jayega. What about today's exercise?" And sure enough, I had to do. I always used to bike to the college. It used to take half an hour. First time, my father took out the car and drove me so that I could reach in time. Why I remember this is because what I have probably a little bit achieved is not mine, maybe my genes, my parents, and providence. So I really thank my stars for having born in such a good family. टाट पट्टी पे पढ़ते थे पर कहाँ चलते चलते आगे आ गए. This is all, I think, providence. I also would like to acknowledge that this award goes to liver. It's not to me, it is to the organ. Because of the work on liver, we all probably have got little voice. Otherwise तो सब दिल की धड़कन सुनते थे. कोई liver की बात ही नहीं करता था. So it is the recognition by Government of India, by the WHO and others कि हम लोग liver की बात कर रहे हैं. And the Institute for Liver and Biliary Sciences is very small compared to all other institutes, AIMS, JIPMER, PGI. But somehow, because of the recognition of the organ, we got this. I want to thank all my students who make me unlearn every day. We start 6 days a week. It's like a 996 system. 9 to 9 students work, teachers work, and the care is all 6 days, no half days. And research is a religion for all of us. So we have this habit, the student must ask, "Sir, aapko nahi aata kuch? Sir, aap padh ke nahi aaye aaj?" So that has probably created that sense of. So what I have been recognized is for all those patients where we have lost, where we did not succeed, we failed to save those patients, we failed to make them better, we failed even in the knowledge of what we are dealing. That makes us humble. We try to read, our students try to make innovations, and I therefore feel friendship with FICCI, which itself is a symbol, for us is a huge recognition. And I will communicate to everyone that FICCI has not recognized just me, probably the institute, the patients, the well-being of all those who have suffered from liver diseases. And sir, with you, I have known you for years. It's a real privilege to receive this from you. And I thank all of you for having given me this love and affection. Thank you.
Thank you so much, sir, and many congratulations. I would now request Honorary Brigadier Dr. Arvind Lal, Chair FICCI Swasth Bharat Task Force, Executive Chairman Dr. Lal Pathlabs Limited, and Managing Trustee ALBL Foundation to give the vote of thanks. Please.
Dr. Serene, once again, heartiest congratulations. Mr. Rajiv Gauba, sir, Dr. Harsh Mahajan, distinguished jury members, awards, nominees, and participants, FICCI Health Services Committee members, partners, and members of the media. Ladies and gentlemen, it is my pleasure and privilege to deliver this vote of thanks on behalf of FICCI at this distinguished gathering of healthcare leaders, innovators, policymakers, and change makers. Instituted in 2009, the FICCI Healthcare Excellence Awards were conceptualized to acknowledge and celebrate those who have made outstanding contributions to the Indian healthcare through innovation, dedication, and measurable impact. Over the years, these awards have grown into one of the most respected recognitions in the healthcare industry, highlighting the incredible work being done to make healthcare more accessible, affordable, and effective across the country. This evening, as we celebrate the 17th edition of these awards, we take pride in how this platform continues to evolve, showcasing stories of perseverance, compassion, and excellence that truly define India's healthcare journey. Each awardee and nominee today represents the spirit of progress that drives our healthcare ecosystem forward. We are deeply honored and grateful to our chief guest, Shri Rajiv Gauba sir, member Niti Aayog and former Cabinet Secretary, Government of India, for gracing this occasion. Sir, in your presence has truly elevated this ceremony. And your words today have reminded us of the importance of building strong, resilient systems that serve every citizen with this equity and empathy. Our heartfelt appreciation also goes to the eminent jury panel chaired by Mr. C.K. Mishra and co-chaired by Dr. Harsh Mahajan for their invaluable time, effort, and judgment in identifying the most deserving winners. Also, special thanks to Dr. Narottam Puri sir, Advisor FICCI Health Services Committee, Dr. Yashpal Bhatia, Chair Awards Core Group and Chairman and Managing Director Astron Group, and to his lady wife, Mrs. Niru Bhatia, for always being here by his side. We have been seeing you, madam, for the last so many years. Dr. Ravi Gaur, Co-Chair, Awards Core Group, Founder and Director DRG Path Labs, and Chairman, Medical Advisory Board, Onquest Labs Limited. This continued guidance and support and commitment have helped shape this initiative. I would like to repeat our gratitude to our process partners EY and Aston Healthcare for their meticulous support and partnership since the inception of these awards. And again, I would like to acknowledge the contribution of Dr. Niru Bhatia of Aston. To all the award winners and nominees, our heartiest congratulations. Your contributions in clinical excellence, innovation, policy, or community health inspire others to aim higher and do better. You represent the finest values of service, integrity, and commitment that the healthcare sector stands for. I would like to thank all the participants, dignitaries, and attendees who joined us this evening to celebrate excellence and innovation in healthcare. Your continued engagement strengthens this platform year after year. And finally, to the FICCI Health Services team, thank you for your hard work and dedication in making this event possible. Each edition of these awards reflects your efforts, attention to detail, and passion to the sector. If I have missed acknowledging anyone, please accept my deepest gratitude and appreciation. Thank you once again for joining us this evening and for your continued partnership in advancing the cause of quality healthcare for every Indian. Thank you once again and good evening, and please enjoy your drinks and dinner. Thank you.
Thank you, sir. And last but not the least, we would request all the jury members to kindly join on the stage for a group photograph. We request everyone to please join us tomorrow at FICCI Federation House for day 2 of the FICCI Heal conference. We have few interesting sessions tomorrow, starting with revolutionizing care through AI, the ministerial session, where the chief guest Sri JP Nadda ji will be joining, therapeutics through technology, hospital of the future. We look forward to presence of all of you at 9 a.m. at FICCI Federation House for day 2 of the conference. Thank you, and please join us for dinner.